Early pregnancy signs in first 2 weeks. In this video, we will discuss: could you already be pregnant without knowing? Some signs appear just days after conception. Let's explore the earliest pregnancy symptoms you might notice in the first 2 weeks. Pregnancy is counted from the first day of your last period, not conception. Week 1 means you're not pregnant yet, but your body is preparing for it. Symptoms of pregnancy at week 1. 1. Mild cramping. You may feel light cramping similar to menstrual cramps. These are caused by changes in your uterus as implantation begins. 2. Fatigue or unusual tiredness. Feeling more tired than usual. Rising progesterone levels can make you feel sleepy and drained, even just a few days after conception. 3. Breast tenderness. Increased hormone levels can make your breasts feel swollen, sore, or sensitive. This is often one of the first noticeable signs. Hope this content is helpful for you till now. Subscribe and hit the bell icon for more such pregnancy-related videos. Please continue watching. 4. Mood swings or anxiety. If you feel unusually emotional, anxious, or moody, it could be those hormone shifts at work, even this early. 5. Bloating. Bloating can begin early as progesterone slows digestion. This can cause mild fullness or tightness around your waist. Symptoms of pregnancy at week 2. 1. Implantation bleeding. This occurs 6 to 12 days after ovulation, when the fertilized egg attaches to the uterine wall. It's usually light pink or brown spotting. 2. Cervical mucus changes. After ovulation, cervical mucus often becomes creamy or sticky. Some women notice an increase in quantity or a change in texture. 3. Frequent urination. Need to pee more often. That's normal. Even in week 2, hormonal shifts increase blood flow to your kidneys. 4. Heightened sense of smell. Some women start to feel a sudden dislike for strong smells or certain foods, an early form of nausea that comes from rising HCG levels. 5. Basal body temperature. Basal body temperature typically rises after ovulation and stays elevated if you're pregnant. It could be a sign if it's been high for over 20 days. Every woman's body reacts differently to early pregnancy. Some experience clear changes within days, while others feel nothing at all until much later. The only way to know for sure is with a pregnancy test, but until then, paying attention to these subtle symptoms can offer clues.